Becky Cooper.
Thank you, Chair. And thanks so much for being here. I just wanted to take you back to a conversation you were having with a previous questioner about smoking cessation in hospitals. I just wanted to ask if you could give us your thoughts around vaping availability in hospitals that allow people who are quitting in hospital or want to continue quitting to continue vaping. And our CMOs said about a smoke-free place being a vape-free place. And I just wanted if you could talk about your thoughts about vaping in hospitals where it's a smoke-free place and access to vapes. Thank you.
Okay, so in Wales, then, obviously we've implemented smoke-free legislation. We've got 7 different health boards and various kinds of approaches to that legislation when it comes to the implementation alongside vaping. So when it comes to indoor spaces, there's already a huge amount of compliance with voluntary bans in those areas, and people generally don't smoke in indoor spaces. So there's already that kind of that public consensus in those areas. When it comes to the outdoor spaces, with regards to smoking and vaping, there is not necessarily a consistent approach across Wales, which can cause confusion amongst the public. I think that we need to be considering this very carefully when it comes to providing as much support to smokers as possible in these areas, and we need to be considering exemptions to vape-free spaces in those areas where people where smoke-free spaces are, in particular in hospital settings, mental health units, and places where vulnerable patients who smoke are situated. So that would be the message, that we need to really consider those exemptions.
In Scotland, we put medicinally therapeutic products front and centre with smoking cessation. So smoking cessation is vital, but I think we need to remember that there is no medicinally licensed e-cigarette product globally anywhere in the world, and that medicinally licensed products have a very different setup. So you're talking with e-cigarettes about over 30,000 different variants listed with MHRA, 4 or 5 generations of devices, very, very different health profiles. Most of the comparisons are made with the toxins in tobacco. There are different additional toxins in e-cigarettes, and there is new research, for example, AI modelling the impacts of heating some of the chemicals in e-cigarettes to vapour point, where they produce highly toxic outcomes. And I think we need to bear that in mind. We also need to look at the research on air quality, because e-cigarettes conclusively contain the kind of particulates that we worry about with air quality that cause harm to health. And that is an issue, I think, arguing for vape-free spaces. So in Scotland, we are supporting people to quit smoking whatever way works for them. We are supporting individuals, but we are only actively recommending medicinally licensed products because they have that context of appropriate use and safety and quality control, which e-cigarettes don't have.
Okay, I call Becky Cooper.
Thank you, Chair. And thank you for coming to give evidence this afternoon. As we've got 2 fellow public health colleagues giving evidence, could I ask you from the public health community what the general response has been about this bill, and if there are any significant suggestions from the public health community as to areas that we should consider further?
Absolutely. From public health community, I think it's widely accepted and supported. I think it gives us a great opportunity not only to increase the conversation but also to broaden the conversation. I think the key things is about how we embed the legislation into practice will be key, and make sure we're getting it to the point of delivery where we can affect change in terms of protecting our populations in the most effective way. So making sure we've got a focus on smoking cessation, making sure that we've got a consistent and unified approach, but also making sure that we have the agility and adaptability to different cohorts and different populations so that we can target effectively. But yeah, from a public health perspective, it's hugely supported.
Similarly, if I might add, from the Association of Directors of Public Health, it is very much welcomed that we've got this bill, and it will represent a sea change in terms of reducing harm caused by tobacco. It is still our biggest killer, and it's we still have significant numbers of people continuing to smoke and still addicted by smoking. So the product itself is not only extremely dangerous, it's also extremely addictive at the same time. So we welcome these measures to come in and address that.
Okay, I call Becky Cooper.
Thank you, Chair. And thank you for coming along this afternoon. You mentioned the New Zealand case, and I wonder if you could just talk about what happened briefly, if anybody doesn't know, about why the standards were dropped, and perhaps the learnings that we might take for our legislation moving forward.
So I think there are political aspects to that I won't comment on,
No.
but obviously the understanding was that it was a very comprehensive and ambitious set of measures that was introduced, not just, again, like this bill, not just the smoke-free generation, but other measures as well, including, interestingly, on the density of retail outlets, which maybe is for another day, one other potential future measure. So a new government came in and decided not to take it forward. But the learning, from my understanding, and speaking to colleagues there, that we need to take from that is going back to the CMO's evidence about the lobbying that's going to occur. The tobacco industry and partners around the industry are very powerful. And so persuading colleagues that it's undermining choice, is going to have a burden in terms of regulation, cost to retailers, etc., those are arguments that were used in New Zealand. And I think we just need to keep a watchful eye as we think ahead to the regulations and the next steps for this legislation, that we don't open that door too widely and allow those arguments to become too powerful. Because as you heard earlier, that industry is continually looking for new recruits to replenish those it loses through morbidity and mortality. And that will happen in the UK as well, unless we get this right.
Okay, I call John Whitby.
Yeah, just following on from the last two questions, actually.
Next question from Dr. Becky Cooper.
Thank you, Chair. Thanks for coming along this afternoon. I just wanted to hear a little bit more about the online issue with children and purchasing vapes, or perhaps being influenced to purchase vapes there, and just perhaps your experience as a head teacher and working in schools. How influential do you think that online environment is? And would you like to see this bill sort of develop more to look at that as it goes forward?
Yeah, I think the online area is hugely influential for children. I think it's where they spend a lot of their time, a huge amount of their time. So I think it would be really good if this could look at that going forward as well. In terms of marketing for it, I don't receive any online marketing adverts for vaping, but I'm not 13 years old. But I bet if I was, I would. So I think that's an element to look at.
Yeah. Dr. Becky Cooper.
Thank you, Chair. Thank you, Minister, for that rousing speech. I'll keep it brief. I just wanted to bring you back to smoke-free spaces. As you say, the bill is going to lead to smoke-free spaces outside schools, children's playgrounds and hospitals, all very laudable and very evidence-based. I think it is important, if you can, that you actually address the issue around hospitality settings. Could you please state to the committee why that is not currently in the bill as it stands?
So we wanted to have a proportionate approach. We recognise the difficulty that the hospitality sector has gone through and is in. We listened to the voices of concern. And look, we decided that as far as England is concerned, and I can't speak for ministerial colleagues in Scotland, Wales and Northern Ireland, but as far as England is concerned, we wanted to target outdoor smoke-free places to areas where children and where the most vulnerable are likely to be. And that leads to the logical conclusion of outside hospitals, where there's a lot of vulnerable people going through the doors of hospitals, outside schools and outside children's playgrounds.
Okay,